One of the biggest stories of the week has obviously been around vaccinations around the country. More and more people are getting vaccinated. It seems all over the country this is happening. National government's very pleased. Let's go to the Eastern Cape. Kidwell Matshotyana is the General Manager for Clinical Support Services in the Eastern Cape Province. Kidwell, good afternoon to you. You've got 1 million registrations. You've vaccinated nearly 800,000 people. They've each got one jab so far. How's the process going?
Good afternoon, Stephen, and good afternoon to Newzroom Afrika viewers. It's actually going very well. We're very excited as the Eastern Cape with the registrations, but also the vaccinations is actually going very well with just over 804,000 that have been vaccinated, both with the Pfizer and also the Johnson & Johnson since the start of the national rollout. So things are going very well. We're optimistic that we will reach our target of vaccinating 4.5 million before the deadline.
Obviously, you're a big province. You're a sort of rural province in a way. You've got 2 big cities, 3 big cities, depending on how you define these things. Is it difficult to get vaccine doses across the entire province?
It has its challenges. We've been fortunate, though, with the partnerships that we've established over the past few weeks, where we worked with the private sector, we've worked with the non-governmental sector to conduct outreach to the rural areas. But also of particular importance was the change in the storage conditions required for the Pfizer vaccine. Initially, it was stable for 5 days at normal fridge temperatures, but later on the storage was changed nationally with the recent findings on the stability of the vaccine. So now it is stable for 30 days, and that helps us a lot in the remote areas where we do not have the adequate or the recommended ultra cold temperature storages. So there have been challenges around the cold chain management initially, but those have been resolved. We still have other challenges such as access to some of the rural areas, and also obviously technology where we need to have people registered, and also as they are vaccinated, that information is captured in real time on the system.
Kidwell, we saw the reports of how difficult the situation in the Eastern Cape Health Department was at one point during the pandemic, I think during the second wave. We know that your province doesn't have the resources of some of the other provinces. You have the resources you need to get the vaccine to all corners of your province?
We do. Most of what we are working with is through the support from the national department. So on the distribution side, we are working with the national service providers that are adequately experienced and with the required capacity to reach all corners of our province. We have partnered with our universities to assist with the vaccination of the general population around the province. So we've managed over the few weeks or few months to build our capacity to learn as we go. I basically look at it as we are building an airplane in the sky, because we learn as we go, we fix the challenges as we go, as long as we are able to reach the public with the vaccination. And there's been a lot of excitement. I mean, the uptake has been very good over the past few weeks. Yeah.
It seems around the country, I mean, there was worries about what people call vaccine hesitancy, that some people might not go and get a vaccine. But it seems the whole country is excited about this. I mean, I know in some parts of Joburg, the moment people at the age of 35 and over were allowed to get a vaccine, they started queuing. Are you seeing huge excitement too, by the sounds of it?
No, definitely. I think this started with the opening of the vaccination for the elderly, the 60 plus. They didn't really bother about all the negative communication that was going out in social media platforms about the vaccines. They were very eager to get vaccinated, to access the vaccination sites. We used our mobile vehicles to reach them in some of the hard to reach parts of the province. And also with the 35 plus, they started the enrollment on the 15th of July, and we've been seeing queues of people coming to the vaccination sites in the category 35 to 49. And to us, that's very exciting because this is one of the most at-risk category because of comorbidities and also just the mobility of the population.
This may be an impossible question to ask, but it might be interesting. I mean, we sometimes talk about how South Africa is an urban country and a rural country. Has there been any difference that you're aware of from how people in rural areas and people in urban areas have received vaccines, or is everyone just excited to get it?
What we've seen for us in the Eastern Cape, there was more excitement in the rural, and there is a lot of excitement in the rural areas. When I look at the villages where people just come forward and get vaccinated, and it's a little bit with the urban areas, it's the up where there's a lot of excitement and there's still that hesitancy in certain of areas. They're just very eager to get vaccinated. They wait and get vaccinated, and they communicate and encourage their friends and neighbors to get vaccinated.
Obviously, everybody wants more and more doses to vaccinate more and more people. How's your communication with the national government? Are you getting the doses that you need?
Yes. We actually working closely with the national team. We receive our stock on a weekly basis, and that is, we basically look at the registration, the estimated population, and also the capacity to utilize those doses. And on a weekly basis, we receive our stock, and if we see a risk of running low, we alert the team at national, and they are always quick to dispatch the stock that we need to the province.
And Kidwell, I mean, often I think health workers, people who do what you do, nurses, doctors, they treat patients who are sick. Now, what's happening is for the first time, the people administering the vaccines are giving someone who is healthy, they're giving someone something that will protect them for the rest of their lives. That must be quite a nice thing to do, I would think. I mean, normally an injection is, you know, to make you feel better. This is an injection that protects you for the rest of your life. It must be quite a nice experience in a way.
No, it is, Stephen, because in the end, our focus really as health workers is prevention of diseases. It's just unfortunate that over time we've always been focusing on treating, but the message of prevention and the vaccine is actually giving us an opportunity to prevent the complications that come with COVID-19 infections, which put a huge strain on the health system. So this is very exciting for us as health workers, especially having gone through the first and second wave of the pandemic in the Eastern Cape in particular. So this is actually an exciting opportunity for us. It's really very encouraging for many of us.
Kidwell Matshotyana, General Manager, Clinical Support Services for the province of the Eastern Cape. I appreciate the time. Good luck with the rest of the rollout. Thank you.